Hi, as I earlier on said, we are going to be releasing a weekly video on some multiple choice questions that can come in your final licensing exams as you go take your Ghanaian licensure exams. Some of the questions come in pharmacology, medical nursing, surgical nursing, advanced nursing, and a whole lot of components. As we are looking at the various multiple choice questions, we are going to look at how to apply our knowledge that we learnt in classroom in answering such questions so that we can pass and pass very well. To begin with, a question like this: Miss Abena Nyakwa, a 19-year-old SHS student of Ahamasu, is being treated for a urinary tract infection. As a child, the patient developed hives due to sulfur. Which of the following antibiotics is contraindicated in this patient? Option A, we have trimethoprim sulfamethoxazole. Option B, we have nitrofurantoin. And option C, we have cephalexin. How would the nurse be able to use his clinical judgment in pharmacology in answering this question? You could see that the options given in the question, the clue was the patient developed hives due to the use of sulfur. So the drug history should tell you that the patient is allergic to any product containing sulfur. And looking at the class of antibiotics, we have the cephalosporins, the sulfonamides, the penicillins, and what have you. You could see that going to the class of antibiotics, the one that contains sulfur, hence not to be given to patients who are allergic to sulfur products, is the sulfonamides. In these options, how will I know, how will I be able to determine the medication mentioned is a sulfonamide? Looking at option A, the trimethoprim sulfamethoxazole. This is a medication that falls under the class of sulfonamides. And so quickly, you should know that the one that will be contraindicated in this patient is the trimethoprim sulfamethoxazole. Option B is also an antibiotic, but has no sulfur component in them, and so play no relevant role in the answer. Option C, which is the cephalexin. Cephalexin is an antibiotic that belongs to the class called the cephalosporins. How will I be able to identify if this medication is a cephalosporin? Most often, the cephalosporin medication is Ceph. Example, you can have ceftriaxone, ceftriaxone. So the CEF should tell you that this medication belongs to the class of antibiotics called cephalosporins. So per this question, looking at what we have discussed, the one that contains a sulfur product is the option A, trimethoprim sulfamethoxazole. Even the medication name, sulfur or sulfur, should tell that is a sulfonamide. Hence, it's contraindicated in someone who has developed allergy towards sulfur products. Miss Atwe Peyeye had an ECG done, and tests revealed that she had a third atrioventricular block. She is likely to develop the following complications except A. Cardiac tamponade, B. Cardiac arrest, and C. Thromboembolic event. Before we can be able to pick this answer, you should be able to understand what a third degree atrioventricular block means. And when that happens, what will be some of the complications? AV block, also known as the atrioventricular block, can also be termed as heart block. What is happening in this condition of the heart will tell you that when the SA node, that is sinoatrial node, fires, which is the pacemaker of the heart, fires an electrical signal, the AV node, also called the atrioventricular node, serves as a gateway to permit that signal to pass through. And so when there's a block from that AV node, it should tell you that the signal coming from the SA node is not being transmitted to the ventricles. And so there's a block. We have types of AV block: the first degree block, the second degree block, and the third degree block. The third degree block means that none of the signals are even passing through. And so when this is happening, what will happen to the ventricles? The ventricles are not able to contract, and so there will be stasis. Looking at option A, cardiac tamponade. What is cardiac tamponade? Cardiac tamponade can also be termed as constrictive pericarditis. In this condition, the heart, when it is expanding, Because the pericardial cavity, which has a fluid filled over there, there is an infection or probably an infection that has caused more buildup of fluid within the pericardial cavity. When the heart is expanding to pump blood out, it's going to meet that resistance. So that's what we call the cardiac tamponade, or we can also call it constrictive pericarditis. And that is what cardiac tamponade means. And that should tell you that is there a vein block, you ask yourself, will cardiac tamponade happen? If you are not sure, let's go to the next cardiac arrest. Cardiac arrest is when the mechanical activity of the heart ceases. That is cardiac arrest. Then the thromboembolic event. Thrombo has to do with what? A clot. Emboli has to do with what? An air event. Would that happen when there's an vein block? We'll find out shortly. As I said earlier, in vein block, the atrioventricular node is not permitting signals to pass through. And so if signals are not passing through to the ventricles, in the long term, the ventricles will not contract. And if the ventricle is not contracting, it won't push blood out into the systemic circulation or the pulmonary circulation. And so when this happens, we can have what? Cardiac arrest. In time to come, the heart will stop to beat. When the ventricle stop beating, the heart can go into cardiac arrest. And so cardiac arrest is a complication or can be a complication of what? A third atrioventricular block, which is relevant in the answer. Let's look at embolic event. When there is a stasis in the chambers of the ventricles where they are not contracting, the blood that is in the ventricles will become stagnant. So when there is a stasis of blood over there, you realize that wherever there is stasis of blood, the chances of clot formation is high. And so we are going to have a thromboembolic event as a relevant complication of vein block, leaving us out with option A as the exception. Cardiac tamponade will be least expected as a complication when there's a third degree vein block. And so per this question, our right option will be the cardiac tamponade, because all this complication will happen when there's a third degree vein block, in exception of what? Cardiac tamponade. That makes cardiac tamponade the correct answer. Our next question is also on a pharmacology question. An asthmatic patient on your ward is placed on theophylline as treatment. This medication is given to the patient to option A, reduce the constriction of the bronchioles. Option B, decrease airway inflammation. Option C, reduce irritation in the airway. Before one can answer this question, one needs to know the drug theophylline and the class it falls under. Theophylline is a respiratory system drug which falls specifically under bronchodilators. Bronchodilators, we have the xanthine derivatives, of which theophylline happens to be an example of the xanthine derivatives. And so, theophylline being a bronchodilator should quickly tell the candidate that it is going to be used in order to what? Reduce the constriction of the bronchioles. That makes option A the right answer. So theophylline is given to help reduce the constriction of what? The bronchioles. Another question that candidates can also look at to digest how it is being set in order to get a correct answer to it reads: Mr. Bentum Elikem, a 25-year-old patient and a known hypertensive, is a school dropout who had been involved in mining activities for more than 5 years. He experienced multiple bee stings. He reported to the outpatient department on the 5th day. Physical examinations revealed peripheral edema, proteinuria, and hypertension. Blood chemistry showed decreased albumin and elevated serum cholesterol. Which of the following is a likely diagnosis based on the findings? A. Nephrotic syndrome. B. Glomerulonephritis. And D. Pyelonephritis. Per the parameters given in this option, you could see that they mentioned that physical examination revealed peripheral edema. There was proteinuria and there's hypertension. The patient's blood chemistry later on also revealed that there was a decreased albumin and an elevated serum cholesterol. These are clinical features of a condition that has been given in the question. Looking at the options, we have A. Nephrotic syndrome. The parameters spelled out in the question should quickly tell you, the candidate, that that is nephrotic syndrome, because in nephrotic syndrome, it is characterized by 4 main cardinal points, which is 1. Proteinuria, generalized edema, also called the analsalca. You can have hyperlipidemia and then hypoalbuminemia. These are the four main characteristics that define nephrotic syndrome. And so per the question, the blood chemistry giving us a decreased albumin level and an elevated cholesterol level, and also physical examination revealing peripheral edema and proteinuria should quickly tell us that the right choice is nephrotic syndrome. Next question. Miss Sylvia Ate, an 18-year-old student, was rushed to the accident and emergency unit by her school authority. History taken revealed dysuria, urge, and hesitancy of micturition for the past 5 days. As a nurse on duty, you were asked by the charge nurse to perform physical examination to determine the status of the kidneys. As you were performing posterior palpation to determine renal function, understand that normal sized kidney is rarely palpable because the urinary bladder lies on top of the left kidney. Strong back muscles. Spleen lies on top of the left kidney. Spleen lies below the left kidney. The options, we have A, I and II. We have B, II, and IV, and we have C, III. I to IV on the screen, you could see that you have to apply your anatomy over here, asking yourself relevant questions. Does the urinary bladder lie on top of the left kidney? Is our back muscle strong? Does the spleen also lie on the top of the left kidney, or the spleen lies below the left kidney? In applying this anatomical questioning, you see that option I is totally wrong. The urinary bladder does not lie on top of the left kidney. Then the spleen also does not lie below the left kidney. And then our back muscles are not strong. And so the correct option over here is that anatomically, the spleen lies on top of what? The left kidney, making the option C the correct answer. That's the spleen lying on top of the left kidney, is correct because when you look at the anatomical picture of the human anatomy, the spleen lies on top of the left kidney, making that the correct answer. In our next video, we are also going to continue to digest various multiple choice questions from surgery aspect for us to see how to also tackle that. There'll be more videos coming up every weekly. I urge all of you to subscribe to the Licensure Hub on YouTube as the interaction gets more sweeter. Thank you.